would like Mr. Wahab as he takes over with the delivery. Thank you. Mr. Wahab, can you?
Yes, please, I can hear you clear and loud.
All right, I'll hand over to you.
Okay, so thank you so much. Thank you everyone for being part of today's presentation. It is indeed a good time for us to learn something about our health. Health is so critical, and we say health is wealth. So it's important anytime we get opportunity to discuss about our health so that we can live our full life being healthy and be happy. Today's topic is so exciting, and I would like everyone to follow as we go through. Thank you so much for your time once again. After the presentation, you'll get a chance to ask questions, contributions, so that we shall all benefit from today's presentation. I'm trying to share the slide for today's presentation so that we can all follow. Please, can you hear me?
Yes, we can hear you loud and clear.
Thank you. So, trying to share the presentation so that we just follow. Okay, so today we are looking at cholesterol. In fact, this is one topic I like so much. It is because most of the times we do not really understand how cholesterol is within the body. Sometimes we get a privilege to do a cup, and we are told our cholesterol level is high, or cholesterol level exceeds the normal limits, and we are confused as to what exactly to do. But this presentation would help us to understand what is cholesterol. It will also help us to know the sources of cholesterol, the usefulness, the benefits. All is not bad when it comes to cholesterol. There are useful aspects of it, and then there's also a bad aspect of it. And so we just go straight. He has done the introduction already, so I will not go any introduction. I'll just go straight to the presentation. So the first thing we ask is, what is cholesterol? What is cholesterol? In fact, cholesterol is a fat-like substance. Fat. Normally, we understand it better when we talk about fat and oil. So we are talking about fat-like substance that is found in all cells of the body. Every cell of our body contains some level of cholesterol, whether you like it or not. The cells also depend on cholesterol to survive and to work well within the body system. So when you look at this fat-like substance we are going to talk about, it comes in different forms. And then it will interest you to know that the liver within our body produces about 75% of the total cholesterol that the body needs. So cholesterol is not just by eating some kind of food and whatever, but the body itself produces about 75% of the cholesterol that is needed by the body. Needed because we use cholesterol in different ways. So if you look at the picture presented on this slide, you'll find, so this is the artery, okay, through which blood circulate or blood flow. And then we are saying that this is the liver. The liver manufactures and produces about 75% of the whole cholesterol of the body. Whilst we also get about 25% of cholesterol from food we eat, from different diets that goes into the body, that produces just about 25%. So we understand that if the liver is producing the adequate volume or level of cholesterol needed by the body, and you are also eating some other food, some other meals that has other cholesterol, then you must understand that your cholesterol level goes higher, and sometimes higher than normal, higher than what the body needs. So the food items, we have foods like animal sources, food from animal sources, the egg yolk, the meat, cheese, milk, and some of these foods we eat. And that is just producing about 25% of the entire cholesterol that we need. So this is just the basis of it. You think of cholesterol as when you eat an oily food, or you use oil, or use any, vegetable cooking oil or whatever to cook, or you are able to get some meat that has some fat level, high fat level, and you prepare your dish. After eating and you decide to wash the bowls, you realize that immediately you add water, to the oil, it solidifies. Instead of melting and leaving the bowl, it rather solidifies and sticks to the bowl. There are different types of fats that are useful to the body. There are different types of fats that the body utilizes. But if you have any fat that is able to solidify quickly under room temperature, or when you add water, it is the same way it also solidifies in the body, in the arteries and in the veins. And that is what will cause problems in the system. So if you have fat with a lower cholesterol level, normally when you wash, you don't suffer. You add a little omo or a little soap, powdered soap, and then before you see, everything washes off. And sometimes it is difficult for us to wash some type of fat, or even the cooking utensils we use to cook. So this is just a scenario for you to understand how the fat within our body works, how it leaves the body, or how it will stay in the body, solidify, and cause problems. This is just cholesterol. And there are a lot of foods which are rich in cholesterol. Please, when I talk about cholesterol, we'll come to the different types of cholesterol we have. This is general to tell you that there is high cholesterol in this kind of food. Beef brain, chicken, the liver of the chicken, even the chicken thighs or the chicken legs also has some high level of cholesterol, the yolk, the cheese and shrimps. These are some foods that have high cholesterol level. There are others you can also read and look at, but these are just some few. Cholesterol is very useful to the body. So that is why I'm saying that we are discussing cholesterol in totality. We will not say cholesterol is bad, we don't need it in the body, because without cholesterol, we cannot survive. Without cholesterol, we cannot survive. The first benefit to the body is the production of hormones. Cholesterol helps in the production of a lot of hormones within the body. And some of these hormones are growth hormones that help us to grow and grow faster. Some of the hormones also help us to develop quickly, develop all the features, and also other functions. Like the energy we use. So the energy we use, part of it also comes from the cholesterol within the body. So cholesterol is not really a bad use at all. Because it is useful. Hormone production is one key area where cholesterol is utilized. The second benefit is the production of vitamin D. Cholesterol helps in the production of vitamin D, and vitamin D is responsible for stronger bones. So if you have kids who take a lot of meat and beef and all some of these things, they have high level of cholesterol, they produce high level of vitamin D, and it strengthens their bones. It's strengthening their bones. And then the last one I would like to also talk about is bile production. Cholesterol is also responsible and is also part of the production of bile within the system, within the body. And bile is what is used during digestion of the various foods that we eat. So at least you know three main importance of cholesterol. That is the production of hormones for growth development, and also the production of vitamin D, which helps us to get a stronger bone, and also the production of bile, which is useful for digestion of the food we eat. By digestion, you are trying to break down the food you eat to get the adequate nutrients the body needs. So cholesterol helps in the production of all these things. it has its own usefulness. And that is why the liver manufactures and produces 75% of cholesterol the body needs for these metabolisms. So what causes the high cholesterol at all? We are looking at about 5 things. The first I'll talk about is the unhealthy eating habits. There are certain foods that when you eat and eat in higher quantity, you increase the cholesterol level above normal, above what the body really needs. Remember, we are saying that the liver is producing some quantity or some amount of cholesterol you need already. And then 25% is supposed to come from diet. But the diet that you choose, the foods you are eating, you ask yourself, does it have high cholesterol or it's minimal? And when we discuss the type of cholesterol, you see that most of the fatty foods we eat that we've spoken about, the beef, some of the milk we take, the yolk, and the chicken thighs and all these things, has some bad type of cholesterol, and that is what causes a lot of effect to the body. So they are saying that unhealthy eating habits can increase your cholesterol level. The second one is also lack of physical activity. If you don't really exercise, if you don't really try to exercise yourself and try to generate some heat within your body, that helps to break down and melt this cholesterol within the body, then you can have it rising to a level. And that is why when you are exercising, we advise that you exercise and sweat. I know it's not everybody who sweats a lot, that is one thing, but most of the time when you exercise and produce sweat, you see that the body generates a lot of energy, which translates into heat. And this heat helps to melt the fat within the body. And you know that with every fat and oil, immediately you apply heat, it starts melting, it starts forming liquid, and very soon it can be drained from the body easily. So physical activity, if you lack physical activity, if you lack exercise, if you are always sitting without exercising the body, if you eat late and you don't try to walk about a little to enhance digestion and you just go to bed, it all accumulates the cholesterol level within the body and it rises. And then the third one is also smoking. People who smoke also have high level of cholesterol. Already you are causing damage to your kidney, the lungs, and some of the vital organs within the body. And so the liver is also affected by the smoking, that the chemicals within the toxins within the smoke, and it affects the liver in such a way that the liver will be producing cholesterol and will not be managing the cholesterol well for the body. One thing I also want to mention is that the liver is the source of cholesterol and is the production site. It is also the site that helps cholesterol to exit the body. So it produces the cholesterol, sends it to all the cells within the body. Once the cells utilize it, it is some type of cholesterol which will carry all the rest back to the liver, and then the liver will convert it to bile, and then the bile will help to excrete the cholesterol, most often in stool, and just a little volume that sometimes comes out of urine. So smoking can also increase your cholesterol level. And sometimes it's genetics. Genetics means you don't really have control. It is inherited. So if you have a family line where most people or few people have high cholesterol for the family, it is possible that you can also inherit some of these genes that produce high level and uncontrolled cholesterol. So this one is basically genetics. Those who inherit this kind of deficiency, that they are not able to exit or to remove excess cholesterol from the body. And obesity is also one cause of high cholesterol. The fact that someone is gaining weight normally results in the production of a lot of fat within the body. So once the fat is produced within the body and helps you to gain weight and become obese, then you are also at high risk of having high cholesterol level in your body. And so let's look at the causes very well. Our eating habits, the exercise, and the physical activity. Then smoking, we need to quit, we need to stop, because the toxin that goes into the body doesn't help in the breakdown of the cholesterol. Then genetics, if it is in the family, if it is in the line, you have people suffering from high cholesterol, it tells you that you could also be at risk. And then, as I speak about obesity, is also one element. And the truth is that cholesterol is the cause of a lot of the chronic conditions we have. Most at times, the heart attacks that cannot be explained, and a lot we are going to speak about. So we also have some things we call the risk factors. Some of the risk factors can be controlled, others cannot be controlled. But it just tells you that you have a risk, or the level of risk you have to develop high cholesterol. Age is one. Once you are aging, men above 40 years would easily have high cholesterol. They have a higher risk of getting uncontrolled high cholesterol level. And then females after 45 years also have a high risk. So, we don't normally test children for lipid profile unless it is inherited or those who are obese. But for adults above 30 years, it is advised that every year you try to check out what the lipid profile. The lipid profile will test for the different cholesterols and their level. So if you're a man and you are 40 years, you have to make it a point that every year you test your lipid profile, which includes all the cholesterol types. And if you're a lady and you're above 45 years, you also need to check. And heredity, as I said, check the family line. Ask, do we have people who have stroke in the family? Do we have people who died of heart attack? Because these are all illnesses that could result as a result of high cholesterol. And then obesity, as I speak, and then the race, especially African Americans are at high risk of developing high cholesterol. These are risk factors. So then that takes me to the types of cholesterol we have in the body. And I'll start from the very bad one. So we have what we call the low density lipoprotein. That is normally termed as bad cholesterol. Why we term as bad cholesterol? Because this type of cholesterol doesn't normally dissolve. It normally solidifies quickly within the arteries. So if you look at the diagram here, this is the artery, and I've tried to get pictures of the different types of cholesterol. So this is what we are talking about, LDL, a yellowish spot we are having, and that is LDL. And if you look at this area, you will see that there's a plaque or something that has formed just in the arteries. Okay, it has attached itself to the arteries, and this is what LDL cholesterol does. It builds up, it binds to the wall of the artery and starts forming a mass, building up there. So it solidifies and forms a mass over here, such that the blood that is supposed to flow through the vein, when it gets to where we have the plaque, you see that it will narrow the plaque. The plaque becomes smaller. The pore between, or the hole within the artery where blood is supposed to flow freely, okay, it's being blocked by the plaque here. And this plaque is normally formed from LDL and other chemicals within the body that forms this plaque. So that instead of your blood flowing regularly, when it gets to the place that has been blocked, it needs some force to push it through. It's like you have a drain that is blocked by elements, by a lot of things. It is blocked. When it rains, you need some force to push over so that whatever is in the path will clear off. So that's what LDL cholesterol does. And that is why it is termed bad cholesterol. So the fact that your total cholesterol is high doesn't really mean it is bad. It depends on the type of cholesterol that is high within the total you are trying to measure or test it. So bad cholesterol is the first one I'm talking about, and that is the LDL. It is very dangerous. So if your LDL cholesterol goes higher, then you are at risk. You are at risk of getting atherosclerosis. Atherosclerosis is a blockage within the arteries, so that blood is not able to flow adequately in the arteries. And you know, if that is not able to flow freely through the arteries, then the heart will need an extra strength to pump this blood through the arteries. And once it needs an extra strength, it means that the pressure with which the blood is going to pump is going higher. And so you can easily develop hypertension, high blood pressure, if you have atherosclerosis occurring because of LDL cholesterol. And then if you look at the body system, every organ within the body needs blood to survive. If the brain doesn't have the adequate level of blood, you can also have a problem. And once there is clot here, okay, once there's this blockage and the clot continues, sometimes you can end up having clots within the body. Some of these plates can break off and it will form clots within the body using fibrinogen, a chemical within the body that's responsible for blood clot. And so if this clot goes through the body and gets through the brain, if you're not careful and it blocks parts of the brain, then you can easily develop stroke. And then if it is not even your brain, but wherever it blocks, you experience some difficult or some severe pains at that area. So this is bad cholesterol, and this is normally our focus when it comes to discussing about cholesterol. It is very, very dangerous. If you have LDL within the body, you start feeling numbness, you can easily develop heart attack because you need extra strength to pump, your BP will go higher, you can develop stroke and the rest. So this is LDL cholesterol, which is bad. And then we have VLDL. The VLDL is a very low density lipoprotein. Just like the low density lipoprotein, VLDL comes with a small volume, but it's also termed as bad cholesterol because it can also build up the plaque within the arteries and resist the flow of blood. And then the next one is what we call triglycerides. So we've talked about the LDL cholesterol, which we said is a bad cholesterol. We talked about VLDL, which is also a bad cholesterol, but comes in a smaller volume. And then we have this triglyceride. This is also lipid, normally found in the body. And whenever you eat, okay, it converts the calories within the body. Okay, the body is able to convert the calories and then stores it as glycerides, which are normally released for energy. So sometimes you eat and then you don't take meals for a longer time. You realize that energy level will be reducing. And when the energy level is reducing, the body goes back for these triglycerides for energy production. So between meals, it is the triglycerides that are used for energy. So that's why I'm saying that not all the cholesterol are really bad in the sense we always think of. But this triglyceride, apart from helping to release energy when we need, it can also accumulate in the body and cause harm and cause crystallization or cause the formation. So we've talked about LDL, which is bad cholesterol. VLDL is also bad cholesterol. And we have triglycerides that generates energy, but when it accumulates at higher level, it can also give you some effects. And then we have the HDL, high density lipoprotein. And for high density lipoprotein, we term it as good cholesterol. So we talk about 4 types: the bad. We are talking about one type which is good cholesterol. And it is good because, so just as I spoke about the yellow one with the LDL cholesterol, we also have the HDL, okay, HDL. And so those are just an example of pictorial evidence to show you how it looks like and what it does. Normally, HDL cholesterol doesn't form plaque, but it rather helps to remove this LDL and bad cholesterol, VLDL and the rest from the arteries and from the veins. It removes them and takes them back to the liver, where the liver, as I said, converts it into bile, and later it is also injected from the body, normally through stool and some few volume through urine. So you can see that good cholesterol helps to remove the bad ones from the system. I don't know, but a scenario would be like you have bad cops and good cops, police officers. You have some good ones in the system who make sure they clean up the system, sanitize the system by taking out the bad ones who join the armed robbers on attack and all those things, to remove them from the system. So if you have good police officers, most of them being good, then they can help to flush out the bad ones, and the effect will have good police service. But if you have just lower amount of volume, concentration of the HDL, then the LDL will triumph, will be more and will cause. So we'll look at this type of cholesterol, and we see how we can manage the cholesterol level within our body so that we don't have the bad effect, but rather we have the good effect from it. So HDL is a good cholesterol. So when you test your total cholesterol and it is high, there's no cause for alarm, because total cholesterol is the addition of the HDL cholesterol, the LDL cholesterol, and the triglycerides. So if the HDL is high, you can have high total cholesterol, but it doesn't signal any problem because the HDL is high. But anytime the HDL is low, then the LDL will triumph and be higher, and that will cause a challenge. So we also look at some effects of high cholesterol, hyperlipidemia. And if you talk about hyperlipidemia, we are talking about cholesterol level above normal. And if it's above normal and the HDL, remember the HDL cholesterol is high, it is good cholesterol, so it's good for the body. But if it's above normal, then you have just a little of the HDL, but more of the bad ones, LDL and the rest, then that is where you have a problem. And some of the effects of high cholesterol, bad cholesterol within the body, will result in the formation of plaque, as I said. A lot of substances will join and form this plaque that blocks the arteries, and that's the atherosclerosis I talked about. And once the arteries and the veins are blocked, then it means that it will lead to some pressure on the heart to use a lot of force in pushing out the blood to flow through the arteries. And that is one problem. And so it can result in angina. Angina is a chest pain, okay? Chest pain, continuous chest pain. Please, let's take this serious. Sometimes we have chest pain and we just forgo it without going for checkup or anything. We think, oh, that's all. I tell you, if you have high cholesterol, high bad cholesterol, and your veins or your arteries are being blocked, especially within the chest, you start feeling some pain. There's a lot of pressure on the heart. And so if you have angina, it's a symptom that you have problem with your arteries or arteries being blocked, and it can be as a result of high bad cholesterol within the body. It can also lead to heart attack. And you know, with heart attack, you can just die instantly. Sometimes our ladies do well so much. And I always say that it is true that men, we work so much and we do hard work a lot, and our women too do a lot of hard work. In fact, going through the 9-month period of pregnancy alone is so difficult a task to perform. And even when it comes to delivery, it is not an easy task. You need a lot of energy. When it comes to being in the house and taking care of the kids, you have to be shouting, be moving up and down here and there. And most of our ladies also work to support the family. So it is true that a lot of ladies also do a lot of hard work, but it cannot be compared to men. As for men, within a short time, the energy level you exert is so high. You exert a lot of energy within a short period, and it accumulates and can give you some effect. But for ladies, when they have any little challenge, any little problem, they visit the hospital. They try to visit the hospital and find out what is wrong with me. Sorry to say, I always say, even if a lady has the fingernails breaking or something, or the hair breaking, they'll try to go to the hospital and ask the physician, what is wrong with me? And if a man is suffering from any of such condition, we think they are strong. So we don't care, we'll not even care to go to the hospital. And that's why normally heart attack is suffered by a lot of men. A lot of men who are healthy, and go to their work and come back all the time thinking they are strong, easily develop heart attack. Because when the symptoms are coming, we don't really look at it critically. We think we are strong. Oh, we think, oh, this is nothing. Like, I can still go to work and come back. And then we keep on postponing our visit to the hospital. So by the time you realize it's too late. And that's why BP in men is so dangerous, because we don't find it early. They are not able to diagnose it early for us to start early treatment. We wait and wait until the level is so high, and then by the time you realize, you can have heart attack. So high blood cholesterol can lead to heart attack, heart failure, and it can also lead to stroke, because the blood circulation in the brain will not be that much, and then you can also have clots developing, which can also lead to stroke. So you can say that bad cholesterol, the result of bad cholesterol leads to serious crisis. Serious crisis. It's about heart attack, it's about stroke, and that's what makes it so dangerous. So dangerous. So how do we diagnose cholesterol at all? As I speak, I told you we have about 4 types of cholesterol that you always have to monitor. But I'll leave the VLDL, which is the less among them. But we look at the 3. You can only diagnose bad cholesterol, high cholesterol by going for it, because we have realized that most patients who have hyperlipidemia have no signs and symptoms. It doesn't show any sign, doesn't show any symptoms. So you might think you are okay, and you'll be sitting and waiting until it strikes one day, and that is all. So you see that most people who develop stroke, it just comes. However, it just comes. The person is strong, moving up and down, whatever. Just one day it strikes. Apart from those who have other underlying conditions, like the high blood pressure, who know and are on medication, but not able to control or manage it properly, or those who have diabetes. Most of the time, the stroke comes accidentally. It just comes, and by the time you are aware, you are not able to move part of your limbs, and it is as a result of blockage to your brain. So because hyperlipidemia, high bad cholesterol level do not have signs and symptoms, it is advisable for you to be testing every year. At least once every year. There are people who have other conditions, and the BPs as I speak about. For them, they are advised to check every 6 months to check their lipid profile. And that's how we call it, the lipid profile. But for those who don't have underlying conditions, you are advised that every year you can just walk into any good lab and say, I want to know my lipid profile. And then you just pay and do it. And by the results that you get will help you to know the next line of action. If it's okay, hallelujah. If you see some differences, okay, some changes, indicating that the bad cholesterol are going high, then you immediately take a medical advice or the necessary drugs to help you. So if you look at the HDL, HDL is green throughout. It means that the higher the HDL, the better it is. Normally, above 1.3 HDL level is good for the body. It's very good for the body. But when you come to the LDL, if you have up to 3.5, it's okay. But if you have 3.6 to 4.5, that is what we call a borderline. Those who have LDL cholesterol 3.6 to 4.5, we call them borderline because the risk of going higher and developing high bad cholesterol is there. But if you have greater than 4.5, then it's a serious concern. You do your LDL cholesterol or your lipid profile, your LDL is greater than 4.5, you are at high risk of developing heart attack, developing stroke. And then we take the triglycerides. These are the normal values, 0.5, 1.7 millimole per liter is okay. If you have 1.8 to 2.5, then we say it's in the borderline. But if it is greater than 2.5, then you have a high level, which puts you at high risk of developing heart disease. So HDL being higher is good for us. So we'll look at how to balance the equation. So you look at the down, and this is the total cholesterol. So we are saying for total cholesterol, anytime you do lipid profile, your total cholesterol should be between 3.9 to 5.5. And so that's normal or desirable. But if it is between 5.5 to 6.5, then that's also a borderline. Borderline is always like the intermediate between the good and the bad. So before you jump to bad, there's somewhere you land in the middle ground. But what happens with especially we men is that because we don't check, because we don't really go to the hospital to check some of these things, we move directly from desirable or normal directly to the high, above 6.5, and then the risk starts. So if your cholesterol level is above 5.5, say 5.6, then we ask ourselves, so what is the composition? Do we have high level of HDL or high level of LDL? And so based on the composition, we can say you have developed more bad cholesterol, more good cholesterol. So you can have total cholesterol of, let's say, 6. But out of the 6, sometimes you can have HDL like 2.0, very high. And the LDL goes down like 3.4. It is normal. The HDL triglyceride also goes low, and it is also normal. So the fact that total cholesterol is high doesn't mean you should start medication. That's what I want to imply, and one of the key messages I want to give. And you check the total cholesterol and it's about 5.6, doesn't mean you should start medication. And you do the lipid profile to find out which one is higher and which one is lower. The good thing is that if the HDL or the good cholesterol is going higher, the others, which are the bad, goes down. And if the bad one goes higher, then the good one goes down. So that's why I talk about how to balance the equation so that you will be healthy. How do you protect yourself or prevent bad cholesterol? Diet is number one. We advise that sometimes you prepare your meal, your food or your meat, and you realize that or you are going to now cook. You realize that there's a lot of fat attached to the meat, and that is what we like. It's like sometimes the sweet things, okay, the ones we enjoy, those are most often our enemies. So you see the fat attached to the meat. You advise that you have to trim the visible fat of the meat before you prepare or before you eat. Try to do that because your body is producing the fat you need already, the cholesterol you need already. You don't need extra cholesterol. So if you are eating and the meat has a lot of visible fat, you try to detach it, trim it before you eat. And when you eat poultry, chicken, especially the thigh, you see that the skin has a high level of fat. You are not supposed to eat that skin. You are supposed to peel it off. Okay, so you skin the poultry before eating. You don't say because it's so delicious when you eat it with the skin, so that's what you do. If you want to reduce or you want to protect yourself from high bad cholesterol, then you have to remove the skin from this chicken before you eat. It's also good to have more meatless meals. We advise the intake of fish to increase fish intake and reduce meat. Because yes, there are some fishes that also have high fat. But if you always see that the fat from fish, even if you are washing it off, it's so easy. It's so easy to dissolve and to detach from the body. But you cannot compare the fat of fish to the fat of a meat. So we advise them. And even the fish that has high fat level too, you need to reduce it. Sometimes when we cook our foods and our meals, and there's a lot of oil on top of the stew or the soup, that is what we like. Oh, it means we are living good. But that is not the case. We don't need that excess oil or fat in the body. So you must make sure things like cheese, you have to reduce the intake of it. And that will help. And then also make sure you exercise. You exercise, especially before sleeping. That is why most of you, we advise you to take your supper before 6 p.m. Because we realize that after 6 p.m., some people will sleep around 8 or 8:30. Most often, if you eat before 6, you can sit for a while, you can walk for a while, you can do some activity for a while before sleeping. By then, digestion will be complete. But if you eat at 8 and you go and sleep at 8:30, then it's likely your body will not be able to digest most of these fats and other components within the body, and that can give you an effect. And that is most often what leads to obesity. If you eat at late and you just go to bed without exercising, you can easily develop a lot of fat under your tissues, or your skin tissues, and then you get fat. And then smoking, so you need to quit smoking and alcohol. These are things that affect the liver, and the liver's production of the cholesterol, and also the removal from the system will be impaired. If the liver is not able to function properly, it will not be able to convert most of this cholesterol and to eject it from the body. So it will give you the effect. And then you also do well to reduce weight. I've also put some foods that you can eat. And some of these things are able to help you to manage and to control and break down the bad cholesterol. So these are some of the fruit and vegetables, okay? Things with fiber. Normally, foods with fiber help to dissolve bad cholesterol, to reduce it. And then if you have things with citrus food, it also helps to break down LDL cholesterol. So these are some of the foods that are normally recommended for those who want to lower their bad cholesterol. And when you are lowering the bad cholesterol, it means that you are also increasing the good cholesterol within the body. Thank you so much for your time. I'll end the presentation here, and then I'm ready to take some questions and discussion. Thank you.
Thank you very much, Mr. Wahab. And that was very insightful. I believe everyone has learned a lot. At this moment, we'll open the floor for questions. If you have any questions, you can kindly ask. You can raise up your hands. I can see Stephen Anson's. Oh no, I think he's clapping. All right. If you have any question, you can kindly ask by raising up your hands so that I give you the opportunity to ask your question. Does it mean we don't have any question?
By itself. It's supposed to also, it is the same liver that's supposed to remove excess cholesterol from the body, because it's the accumulation, okay, to a high volume or quantity that is going to affect the body. And the liver is responsible for that. And most of the time, smoking and alcohol has direct effects, adverse effects on the liver. It impairs the liver from functioning properly. So the food you are eating can give you the cholesterol. Instead of the liver converting it to the bowel to eject it from the body so that you will be okay, the liver is not able to perform that function, that role well. So all the cholesterol that you are eating, especially from the meal, is going to add up to the little that the liver is producing. And it will be storing it in the body. And that's what will lead to the accumulation. So smoking, especially, and drinking, and there are some other chemicals that goes into the body, impairs the liver from injecting this bad cholesterol, and that's what will lead to the high cholesterol.
Okay, thank you for your response. Ephraim, I saw your hands up. You can kindly go ahead and ask your question. Before that, Esther, I believe your question has been answered.
Yes, please. It's been answered. So in short, it means that the smoking and the drinking does not really cause high cholesterol, but rather it affects the liver, which causes the liver to, it causes malfunction of the liver, right?
Yes. It causes malfunction of the liver,
okay.
And so the liver is not good.
Okay. Thank you.
Ephraim, if you can hear me, you can ask your question. Hello, Ephraim. Your hands is down now. Doesn't mean that you don't have a question anymore. All right. Anyone with a question? Okay, let me ask this question again. Some of us, to be frank, we don't exercise a lot, which we've learned today that exercising reduce our risks of having excess cholesterol in our body. But we do active work. You know, our work we do is more active and physical. Can it replace the exercise we don't do?
Star 500 hash to enter now.
So in health, exercise is a deliberate activity. Exercise is a deliberate activity. Just as you plan to eat, or you take water and you drink, or when you are thirsty, it's the same thing. Exercise is supposed to be part of our daily activities we do. And as I'm saying, it is deliberate. So the brain is focused on what to do. And so once the brain is also focused, the whole body responds to it. And when you're exercising too, it's not just a part of the body, but it should be the whole body. So that and you see that when you exercise, your heartbeat is higher. And in fact, the heartbeat higher helps blood circulation, quick blood circulation. Okay, so that the heat within the veins and the arteries will also help in breaking down some of those bad cholesterol. So it is true that sometimes we work so hard, but it's like we are doing just exercising just some few parts of the body instead of getting the holistic exercise. So what we are talking about is planning for it and doing it daily, or if it's not daily, 3 times a week, deliberately. And if possible, especially for most people, when you sweat a little, you see that it will be injecting not just about having cholesterol, but there are a lot of chemicals within the body that is injected through the sweat when you exercise or when you pass out urine. So yes, sometimes we have that excuse that I work so tirelessly through the day. But what we are saying is that get the time, plan to exercise 15 to 30 minutes. And that's what we are looking at.
Okay, thank you very much. The floor is still open for questions. So if you have any question, you can feel free and ask. If you are a shy type like me and you can speak out, you can also type it on the chat and I will be able to read it out. I also want to ask this question. Is it possible for someone who exercise regularly still have high cholesterol?
Yeah, so highly possible, but it's a reduced risk. I'm saying highly possible for it to happen because the risk factors is not eliminated only by exercise. So there are other things that come to play. So normally that's why it is important you don't take the exercise out, but you add the exercise to the other factors I talked about. If you exercise regularly, but you still consume foods or meat that has high cholesterol, then it means that you want to take out the cholesterol and then you are still introducing more of the bad cholesterol within the body. Sometimes it's also inherited, as I said. So normally exercise is one of the vital activities to do to reduce the risk. But somebody who is exercising but still not following the other preventive measures, like quitting or stopping the smoking, or like stopping or reducing the intake of the meat with the fat, can also have high bad cholesterol. So it is possible, but it reduces the risk. So you do exercise plus the other things we talked about, and then you are okay too. And then let me even add this. Sometimes there are people who are not fat, but they have high bad cholesterol, high LDL. I said obesity is a risk factor. Heredity is part. So if you inherit the genes and you produce very high cholesterol and you also take in bad cholesterol, it doesn't matter your weight or your size, you can still get high bad cholesterol and develop the effect from it.
Okay, thank you very much for the answer. Again, with people who inherit this or who have these genes, how do they go about it? How do they prevent high cholesterol if they have it in their genes?
So, going by the preventive measures, it is true that there are certain things you cannot stop within the system, like the hereditary I talked about. Yes, but even if you have the genes and you are able to take care of yourself, you are able to follow the preventive measures, you in a way, like if you exercise, you still reduce it, and you are not introducing most of these bad cholesterol diet into your diet. Because if once you inherit it, it means that for you, your chances of getting high cholesterol, which will lead to heart attack and stroke, is very high. So if you know you have inherited, you check 1 or 2, it is still high, even though you are not fat, even though you might not be eating so much of, then it tells you that you have to have 100% preventive measure. Because the little mistake you do, it will add up to already the defective genes. And you see, when the genes we are talking about is either the defective gene is helping the liver to produce higher than normal cholesterol. It is not. So you can inherit a gene in such a way that the liver is producing higher cholesterol more than the body needs. Just like those diabetics who sometimes are not able to produce the insulin at all, which will help to break down the glucose. Or sometimes they produce, but it is not enough. It is the same thing with inheriting genes that could produce high cholesterol. So once you are producing high cholesterol from your genes, and 2, once sometimes your liver is also not able to eject or to convert, that's also another problem that will also happen. It means that the other factors, such as the reduction of your meat, reduction of fatty foods, your exercise, taking in water, taking more vegetables and fruit, you have to make it 100%, okay, preventive measures. And then that will also, that's what is going to help you.
Thank you very much for that. My fellow brethren, the floor is still open. You can ask a question.
His or her lipid profile, and might want to share what he or she saw, and then the explanation that was given. You can share with us your experience. If you were able to go to do the lipid profile and they told you your result or explain certain things, you can also share with us.
Yes, program. Me.
Okay. It seems there are no questions coming forth. Does it mean we are satisfied with the presentation? And we can comfortably bring our program to a close. Okay, if there are no more questions, I would want us to bring a close to our session for the day. I believe it has been very insightful. I've learned a lot, and it is an eye opener, especially for those of us who don't exercise much. We concentrate much on our jobs, thinking that we are very active with our jobs, so it's enough exercise for us. I think this is an eye opener, and we have to do something about our exercise habits. We've learned a lot. We've talked about the causes of cholesterol. We've talked about the risk factors. I believe for us, especially we the blacks, we don't have the habit of, going to the hospital for tests, for checkups. But today, I think we've been educated that it is a good habit to continually go to the hospital or to a lab to check yourself up. Thank you very much, Mr. Wahab. On behalf of the Jesuscina Foundation, I really want to thank you and appreciate your time. We are much, much grateful. And to everyone who made it to today's program, we also want to extend our sincere appreciation to you. We say thank you very much. Without your presence, I think the program wouldn't be a success. So on this note, we want to bring our program to a close. We want to end our program for the day. And I've seen so much comments in the chat box appreciating the good job Mr. Wahab has done. I can see thank you, MLS Wahab and Jesuscina Foundation, for this educative lecture. Thank you always, Mr. Wahab, for educating us on important topics. Yes, I can see people appreciating you, and it tells how important your time you spend with us is to us. We can't thank you enough, Mr. Wahab. Thank you very much. If you have any closing remark, I'll give you the opportunity. If not, then we can bring our program to a close. Hello, Mr. Wahab. Do you have anything to say before we close? Hello, Mr. Wahab, can you hear me? I think.
Yeah, so I would like to thank everyone for their participation, and our health should be very paramount to us. Especially there are things that will not even give you any sign, any alarm at all. So let's going to do self-check is very important. I always want to